Today we're going to be running back a bunch of different stories that we talked about last week, and then in one instance, at least for one of the videos of today, it's going to be a story that we touched on yesterday, okay, because there's been quite a big development in that one, and even the video that went out yesterday is a little bit out of date, but it did snowball over the last 24 hours, so I'm kind of glad I ended up waiting mostly by a happenstance on that one, because that one was recorded a little bit earlier in the week, because taking the weekend off is just been beneficial. I think the channel, coming back refreshed on Monday has really helped out a lot of different things, and it's kept me a little bit more sane in these very, well, I don't want to trot out that tired old expression, during these trying times, but they get to be, oh god, it's not really overwhelming, it's more or less just absolutely absurd, okay, because like we pointed out last week, especially with Austria locking down the unvaccinated, and then you had Germany following suit, you know, wherever those two go, they have a history of kind of working together to tyrannize, well, the better part of Europe, and hey, guess what, it trickled over to one of their old Axis allies there, Italians locking down the unvaccinated, because they said, hey, it wasn't gonna fucking stay within the confines of the old Austro-Germany fucking coalition, and yeah, Mussolini's old stomping grounds kind of makes a lot of sense that they would be the next one to hop on board. We'll see where it goes after that, but if you guys want to read through the rest of that, yeah, I'll link through that. But basically, they just seen what Austria and Germany are doing, and they're like, ooh, we're gonna go ahead and hop in on that, but that's already been going for just about an entire day, because it took effect today, December 6th, or whatever the equivalent would be over there with the time change and all that stuff. I don't know what they'd be, so I guess probably 8 to 10 hours ahead of me. So yeah, they had the entire day locked down to the unvaccinated people. So you know what, hey, again, it's not about your health, it's all about control, and it's starting to take hold stateside, okay? But again, all right, this, I don't know how long this is going to be staying up for. Definitely, well, de Blasio's within his last couple of weeks of being mayor, obviously the worst mayor in New York City history. I don't think anybody else, like, you got Koch and you got a couple of those other guys that let New York City become an absolute destitute hellhole. De Blasio, he took the work of, like him or not, okay, Michael Bloomberg wasn't that bad as a mayor, okay? He wasn't as good as Rudy Giuliani was, being able to turn around New York City, you know, from the doldrums of the Koch and those other idiots from the 80s, turning all of that shit around and making New York City like a place people wanted to fucking live. And Bloomberg ended up kind of continuing that for another couple of terms, but then de Blasio, yeah, he just absolutely sunk the shit into a place where it's going to be a few generations before New York City turns back. But what he's trying to do, well, full private business, private person, okay? He's just trying to drop a fucking vaccine mandate on the entirety of New York City. Don't know if it's going to hold up in the courts, judging by what's happening to Biden's stupid vaccine mandates in the courts. Doesn't look like it's going to have a lot of legs, which is a good thing, but this is New York after all, and their court system, top-tiered fucked. So take that with a bucket of salt. And then again, Eric Adams, he's coming in as the next mayor of New York, and he seems fairly moderate, fairly level-headed, but he's also kind of waffled on walking back any of the other COVID restrictions. He says he's going to be looking at them, so we gotta, you know what, hey, look to that with at least a little bit of an eye of optimism, because he isn't Bill de Blasio, and he hasn't espoused anything remotely close to the opinions and the warped fucking worldview that this dude has. So let's see what New Yorkers have to deal with, at least for a couple of weeks. New York City will mandate the coronavirus vaccine for all private sector employees starting December 27th in an attempt to combat the Omicron variant, which is more or less the bigger umbrella topic that we're going to be going through for this video. Mayor Bill de Blasio announced the first in the nation measure on Monday morning, and it'll probably be the first in the nation to get struck down in the courts, potentially, probably, calling it a preemptive strike against the Omicron coronavirus variant and a measure that will maximize vaccination quickly. Yeah, because you're forcing everybody to fucking partake in this thing I can't say. so he can quickly get ahead of the Omicron and other challenges we're facing right now with COVID. It's weird, right? Because, we'll get to that. And you know what? Hey, fuck it. I'll just pull it up because it makes sense. One of the first people to actually, test for the Omicron variant was fully vaccinated, by the way. So we'll get to his statements. So again, if we're just doing this in order to get ahead of the Omicron variant, one of the first people stateside was fucking all fully vaxxed up. So is this really about your health? Nah, you guys know better than that. All private sector employees in New York City will be covered by this vaccine mandate as of December 27th. Okay. And again, how do you have jurisdiction to do this? I don't get it. I don't know. And I don't think he does either. Bill de Blasio's mandate also expands indoor dining, entertainment, and fitness vaccine mandates for children ages 5 to 11 years old. So if you're under the age of 4, congratulations, you can go wherever you want. You're still unencumbered by this insanity. But as soon as you hit the ripe old age of 5, you better get those fucking vaccines in your system. Individuals who are between those ages and unvaccinated will reportedly be refused service at restaurants, entertainment venues, and gyms. Okay, I don't know how many fucking 6-year-olds are going in there and pumping iron, but you better have your vax pass. The new measures will also require 2 vaccine doses, up from 1, to be considered fully vaccinated. And don't worry, eventually, given enough time, and if enough people, don't just do the obvious thing in order to make these non-enforceable, but just not fucking following along with this insanity and just doing their own thing. That's the only way we're going to get through this, is if enough people realize that, really, are we doing all of this for this fucking variant? Okay, especially with the information that we know on it. Yeah, no, we're just not going to go ahead and follow whatever the fuck you say. So yeah, eventually, like right now, okay, you need 2 doses, okay, we're going to give you 3 weeks to be in accordance with this. You just don't fucking enforce them, especially if you're one of the private businesses in this. But eventually, yeah, it's going to be, you're going to need the booster. And then given enough time, if you give the government enough time to do this, they're going to be, okay, well, you have to be boosted up from your last booster in order to, be in compliance with shit. The only way that we get through this is if we stop complying with their fucking insanity. Bill de Blasio's Omicron variant measures come as the virus has spread to 17 states. Oh my God. And it's so awful, right? Well, the Washington Post, reported on Monday, it is rapidly spread, though candidate Biden promised at least 10 times in 2020 to shut the virus down. Yeah, he's been super successful on that, but we're not actually dragging Biden today because I don't even know what the fuck he's up to. Maybe he's like taking a really long Christmas break, because I haven't seen anything that he's done today. He's probably, up somewhere, I don't know, having a rest because he worked so hard in like July or some shit like that. He's old, who cares? But we got some, that's going to be the doldrums. That's going to be as worse as this story's going to get, and it's only going to be going up from here because we actually got something really cool, okay? And I don't really care about any of these fucking vaccines or any sort of these pills or any of these other gimmicks that purport to vaccinate you, protect you against something that needs to be enforced. Okay, if you want to take the vaccine, that's fine. If you want to take the pill as a symptom suppressor, that's fine. Okay, and then there's also a gum that's coming out. That's weird. All right, but it's using some basic bitch technology, like really basic. So it's just insane that nobody really thought about this, and it's weird that it's actually being incredibly useful. Gum laced with plant-grown protein is found to reduce the coof transmission by 95%, okay, after trapping and neutralizing the virus in a person's saliva, Penn State University scientists find. So not some hack backwater college, okay? They're doing, like, real studies and finding out that, quote-unquote, shutting down the virus is pretty simple if you just use some really basic science and you get the fuck out of the way. A new type of gum has been found to nearly eliminate transmission. 5%. And that's like, what, 5 times as deadly? Or, I'm sorry, 5 times. What's the proper way to word this? Less effective. Okay, it doesn't cover the 5%. Okay, so you can still transmit the virus 5% of the time. Oh my God, that's still 5 times more substantial than you could actually die of by actually, a multitude larger than that, because it's still less than 1% for most of the healthy population, but I digress. New type of gum has been found to eliminate transmission, nearly eliminate transmission, sorry, don't want to be spreading any misinformation. A team of scientists led by Penn State University infused gum with a plant-grown protein, and it found it traps the coof virus, the protein known as ACE2. That shit has been around for fucking ever, and it's just been discovered to be useful in this scenario. It's weird, right? But prevents the virus from attaching to the host cell in the human body by interacting with the coof receptor binding domain. This facilitates virus attachment to the receptor and fusion with cell membrane. That's really fucking cool. The saliva samples for coronavirus patients are exposed to the ACE2 gum. Researchers observed 50 milligrams of cinnamon-flavored gum. Well, at least it tastes good. Unless it's like Freedent gum, where it's just gonna kind of fucking ball off and, just disintegrate into dust in your mouth after about 20 minutes of chewing. But I still think that the flavor's gonna disappear so quickly, and you're just gonna have to keep chewing piece after piece all the time. Anyways, reduced viral entry by 95%. That's really fucking cool. Research team is currently working towards obtaining permission to conduct a clinical trial to evaluate whether the approach is safe and effective. Oh, like they give a fuck about that. Oh, when tested in people infected with the coof. Okay, so right now in trials, they realize that it's 95% effective at stopping transmissions, and now they want to take it to actual people who have tested positive for the coof. That'd be pretty fucking helpful, I guess. And again, if it's, it's something that people want to take, okay, if you want to chew some cinnamon gum that kind of looks like, I don't know, CBD tablets, you do you, that's cool, that's fine, alright, and if you can find a way to work it into less intrusive shit, like, I don't know, some kind of a toothpaste or something like that, that's pretty cool too, okay? And if you find out that ACE2 proteins are very, very effective at stopping the transmission of this shit, they won't be able to continue with this nonsense too much longer, and by they, I mean the government, of course, because I'll link to this, obviously, in the description and all that kind of fun shit, but let's get to the Omicron variant itself, because that's what all of this hubbub's about. That's what all the new discoveries are all in anticipation for. This is the fight that we need to square up and we need to take seriously. Yeah, well, the Omicron variant may cause less severe disease. Yeah, we talked about that, okay, like last week, okay? I did a video where it's like, oh my god, it's the new variant of concern. Why is it so concerning? Well, there's fewer symptoms than like every other variant that we've come across so far. Okay, then why are we locking everything down? Why do you need to have a fucking negative test within a day of arriving, or rather, departing your flight and then arriving in your destination? I think that's specific to Canada, the United States, most of Europe as well. It's like you need to be testing and shelling out a bunch of money for some tests that they already bought from specific labs, because they ain't getting that fucking money back, so they better get a return on their investment in some way or somehow. They aren't going to be able to hold on to this shit much longer, because really, if we keep getting more variants of concern like this that are all around less scary, even if you were scared of it to begin with, when it was going to fucking be eating people by like 30% of people who catch it, yeah, sorry about that. You were probably one of those people that always wore gloves wherever you went, and then would be spraying Lysol in the air whenever somebody sneezed in public, you fucking weirdos. The Omicron virus variant may lead to less severe cases of the coof than earlier strains, according to data from South Africa, where the variant was first identified last month. Conflicting reports on that one, because apparently, like a few weeks or maybe even a few months later, it's something I seen when I was doing research for this, but it did, didn't really pour out that much information. It looks like it could have been discovered in a Scandinavian country. I think it was Switzerland. It was either Switzerland or Sweden, one of those S countries up in Northern Europe. Might have been discovered there like 6 weeks or 6 months earlier than that. Like, it really matters, but still, it's being attributed to South Africa. So for whatever that means, I guess. It's like the Delta variant is for a specific area in India where it was first discovered. Okay, but we still have to call the coof a coronavirus, even though that's a designation. That's like calling a Corvette a car. It's like, you know exactly what it is, you know exactly who made it, and exactly what make and model it is. Why can't you call it specifically that? No, that would be racist. So, but whatever, that's just a little tangent and sideshow, and just another one of those things that I think about every once in a while. Why can't we just call it the fucking China virus? Oh, that's racist, right? Fuck off. Most of the hospitalized patients admitted with COVID did not need oxygen, a contrast to earlier in the pandemic. The South African Medical Research Council said in a new report. 42 patients at a COVID ward inside one of the hospitals in Gauteng province, the epicenter of the latest wave. On December 2nd, 70% did not need oxygen and had no respiratory symptoms. All right, so 70% of just 42 people. It's like, oh, okay, this is the variant of concern. Cool. They described the patients as incidental COVID admissions. Oh, okay. Because the patients were admitted to the hospital for medical or surgical reasons, not for the coof. Oh, okay. So they just happened to have the coof. Okay, they weren't there because they had the coof. They were just, hey, it's like, hey, you're positive. Oh no, you have this world-ending disease in your system. How do you feel? Fine. Oh, okay, cool. We should probably lock everything down now. Out of the 13 patients that required supplemental oxygen, 9 had a diagnosis of COVID-19. Oh, okay. This is a picture that has not yet been seen in previous waves. That, yeah, we're probably through this at this point. If things just continue to kind of mutate and we keep getting new strains that are just less severe than the original one was. Because if you guys remember the pre-Delta wave, it's like, oh, okay, cool. What's the difference with the Delta variant? Oh, it's far more transmissible. Really? Where's the data for that one? It's far more transmissible. Okay, cool. We got you. And this one, oh my God, the Omicron variant. Do you guys know how quickly this travels? No, please tell us. Oh, fuck, we didn't expect a follow-up question. It's like, okay, fewer symptoms too? Sweet. Because now you don't lose your sense of smell or taste, for the most part. That's what we found out beforehand. And then there's something else that you don't have a dry cough anymore. So it's like, oh, okay, cool. Do you even know if you have it anymore? It's kind of something else that was happening earlier in the pandemic too. But you know what? Hey, they're going to continue to go on for as long as they possibly can, because this whole power trip that they've been on for the past 2 years, they know it's eventually going to come to an end. They're just trying to drag it out as far as they possibly can. This is a picture that has not been seen in previous waves. In the beginning, all 3 previous waves, and throughout the course of these waves, there has only been a sprinkling of patients on room air in COVID wards, and these patients are usually in the recovery phase when waiting for the resolution, have a comorbidity prior to discharge. Yeah, so the people previously who were admitted to hospital, yeah, they were like actually sick with some underlying causes as well, and then they had the coof on top of that. But these ones, I don't know, they're just kind of fucking drying out in open air wards. Cool. COVID ward was recognizable by a majority of patients, being on some form of oxygen supplementation with the incessant sound of high-flow nasal oxygen machines. My God, somebody call the Michigan school shooter, because that would be fucking annoying. Or beeping ventilator alarms. Another sign of optimism regarding Omicron. Well, while COVID-19 cases were shot up in recent days, the in-rate hospital deaths linked to the disease, 6.6% in the previous 2 weeks before the report was published, versus 17% in the year and a half preceding the time, in that preceding time period. A drop of nearly 11 fucking points. And we need new regulations for this. Why exactly? But yeah, we teased it earlier, so we might as well go to the first-hand account of this guy. It's like, okay, so we know that oxygen supplementation is not quite as needed. Okay, several sensory issues that arose from catching this specific strain of the coof, okay, they do not arise. Okay, the dry cough does not arise. So what's it like? 30-year-old fully vaccinated Minnesota man, oh, of course it is, who received a booster. So this dude was 3 times jabbed up and he still caught a fucking Omicron case. That's okay. Is one of the first confirmed cases of the Omicron variant, he revealed on Monday. Peter McGinn said he attended oh, God. He attended an anime convention in New York City in late November. Ugh. And later said that he tested positive for AIDS. The illness when he returned to Minnesota, I particularly felt safe with my body pillow. With the people that I was with. And so it never really crossed my mind to think that I had the coof. Wow. Imagine that. Catching this brand new world-ending virus, this new variant that's supposed to kill us all, and then not really even knowing that you had it. Thank God you had that booster jab. Am I right, my guy? He's not my guy. He's probably, I don't know, too busy reading the latest issue of One Piece. Is that an anime? I don't know. I don't watch that shit. McGinn said that he and other attendees who are fully vaccinated, of course they are, you had to be in New York City, that makes sense, went to the anime event. Half of the group, who told ABC, tested positive for the virus, positive COVID, threw me for a loop because I really wasn't feeling sick. Oh yeah. McGinn told the Star Tribune, adding that he experienced mild symptoms. He didn't even know he was sick. Mild symptoms. All right, cool. I feel great. Mild symptoms. The Minnesota Health Department, he said, called him days later to inform him that he had contracted the Omicron variant. Excuse me, sir, we have a mask on our end of the phone. Could you please oblige? Because we need to tell you some very specific information. The agency asked for the names of the people who he was with and where they lived for contact tracing. Like, he fucking knows. I don't know. All of his friends are fucking two-dimensional. I honestly felt fine the entire time, he said. Wow, deadly. Adding that he believes the vaccine aided his recovery. Of course, yeah, just listen and believe, right? Well, he's from Minnesota. What could you really expect? I'm more interested in seeing the results, like if more people get this and what their reaction to it. Fair enough. First confirmed Omicron case was reported by California's Bay Area last week. Little information has been revealed about that person, but at least this guy came forward and he had a harrowing tale to tell, right? Like, I barely felt any difference. But it's something that's being shared by ER doctors, okay, and the people who are actually on the ground. So Omicron may provide natural immunity with mild symptoms. Yeah, exactly. Be like, what's his nuts there? Hatsume Hiku there. Dr. Omar Hamada on December 1st said that the Omicron variant of coof may provide natural immunity without inducing severe illness, as the symptoms so far resemble more of a mild common cold in South Africa. Yeah, seems to be about true. In an interview with NDT's Capitol Report, the emergency room doctor and former U.S. Army Special Forces Lieutenant Colonel said that even though we're seeing an uptick in the number of people affected, yeah, but what about hospital admissions, though? The shit that we're actually, concerned about. Yeah, but he's getting to his point, okay? We're gonna go ahead and we're gonna let Jeff Goldblum get to the point here. The severity of the disease seems to be, at this point, minimal. Yeah, that's kind of exactly what we're expecting here. So if people end up catching this, okay, and then they manage to survive this very deadly and very world-disrupting phase, sorry, I don't know how much longer the governments are going to be able to enforce this pandemic before people start to realize that, wow, this is kind of fucked, hey? Like, a bunch of people, okay, but I feel like we're in the vocal severe minority on this one. Like, maybe, oh god, if I was to put a number on it, like 25% of people realize that this has been total bullshit for a while now. I feel like it's somewhere around that. It's nowhere near the 50%, okay? 40%, maybe. The low information people that are out there who still think overwhelmingly that if you catch the fucking coof, it's basically a death sentence. That's the prevailing opinion when it comes to just low information people who take their talking points from media, okay? And I get it. It's fine. You don't have the time to do the deep research that people like us do. And it's like, that's fine, okay? I get it. But you should actually know what the fuck you're facing here, okay? You're facing basically a cold, okay? Something that resembles a mild to common cold. Something everybody gets, like, what, once a year, every 2 years or something like that? Thankfully, I keep myself in pretty decent shape, okay? Exercise, eat a good diet, okay? Get a fair amount of rest, all right? And I get, you know what? Hey, I might catch a cold. I caught the coof around this time last year, and you guys basically couldn't fucking tell. All due to the fact that properly supplement, properly eat right, and properly, you know what, exercise and rest as well. So once more people come around to this, or eventually, you know what, all the symptoms start dropping off, I'm thinking if I'm going to be putting a date on anything, we're probably looking at the end of this pandemic. I'm hopeful on this one. Remember, this is prognostication. Probably by about the beginning of summer, right about the time that a lot of people need to start hitting the old campaign trail for the midterms that are coming up at the end of 2022. So if we can get through this winter, I'm not saying that nobody needs to stop fighting and nobody should be putting any bets on this, but yeah, it really looks like just a fucking tenuous grasp on this, even less so than in previous times. You can name it as scarily as you want. Oh my god, Omicron, that sounds so terrifying. You just do even a cursory amount of research and you realize that, yeah, this ain't really much to be fucking too terribly frightened about. But you know what you should be frightened about? School shooters! And that's going to be up next. With that said, I thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.